Hi, my name is Lee Jerls. Welcome to Lone Star College, Kingwood Hospital. This is our clinical simulation lab. And today we'd like to share with you moulage for an acute abdomen. This can either be a dehiscence or this can also be just a distended abdomen. It looks like you need a lot of supplies to do this acute moulage for acute abdomen, but it's not. You just need some balloons. I prefer to use white colored balloons. You need some blood. You can also put some blood, or you can fill this with chocolate pudding and use fecal spray, and you can make it as a dehiscence or a bowel rupture. So we just need balloons, we need blood, and we need an incision. And here's our incision, and we just take one off and we put it here on our wound on the abdomen. The pump that you need is nothing merely more than just a fishing, it's a pump, an air pump that goes into a fish tank. Costs about $13 at your local stores here. And what it's going to do, it is connect, we plug it in here. And it has this nice long hose here, and what you're going to do is feed it through here, feed it underneath the skin of the mannequin, and it comes down here. I put it between the breasts so that there's no added pressure on here to kink the tubing. And the hose is actually connected to a 9-inch balloon with a rubber band. That's all that you have to do. I have protected the cavity, so this is a spinal sim, so I've protected the cavity with a washcloth. I have also protected the top that will go on it. There's an extension here. You guys will have a tubing. I put it in a little 2x2 and taped it up so you don't have to worry that you're going to get any fluids within the cavity or on this and mess anything up. What we're going to do is, the goal is for that balloon to blow up, and after I place these balloons in here, it will rupture. And I just want to give you an idea of how this balloon will blow up. Again, it's very not too much noise or anything. If the patient's talking to the patient is talking to the nurse, it will kind of just take her attention off of this. So I would just come around here on the other side of the curtain, and I would come through here, and I'm just going to turn this. And as I turn this down, you see that the balloon is inflating. And that's the whole goal. That's the working part of this. As that balloon inflates, the balloons that I put on top of it will put pressure on it and will actually have this come across and have this come off. Okay? So you kind of get to see what's going on in there. Now if I want to let it go down, the abdomen, maybe they do some interventions and the abdomen is not rigid or not distended anymore. All I have to do is just let the air out of the balloon. And again, you know, the little hissing noises, the patient could be talking to the student, or it could be actually vomiting, whatever. This is a good idea, or a good situation that when we can bring back the basic fundamentals. So now I'm going to just show you how we do it, how we put it together here. I've blown some balloons up. I have also filled some of them with baby lotion, and all you do is, then that just gives it a different feeling. You just put it in here. Baby lotion goes in here, syringe, push it in here. I did, and then go ahead and insert a little bit of air, and then I've tied it off. What I do is I usually pack this, there's no right or wrong way. I just pack it so usually that these ends can come out, and you see that I have different shapes in here. This one I just filled with air, and always try to put the tips down so that you make it very realistic. This is going to go in here, and again I've filled these with just some baby oil. Okay, so I have that in here. Now what I need to do is put my top on here, and you just close it in there, kind of leave this one side open, gaped a little bit, but it usually comes off. And I'm just going to apply it here. Go ahead and spray some blood on here, load it up there, and then I'm going to put this too here. And the reason I keep this packing on there is because I don't want initially I don't want the student to be seeing a lot of blood. Okay, because he's maybe a new post-op. All right. And as they're feeling that abdomen, and you can have your patient complain of pain, they can be vomiting. Again, fundamentals, teaching your students to splint. Complaining of pain, And then again, the verbal, oh, my stomach, it hurts so bad. Help me, please help me. And then when the patient when they come in and assess it, again, the bowel is coming out. Probably a little bit more balloons. When they start to look underneath the dressing and that, they can see that the bowel is coming out. And then what we would expect them to do, again, get a wet dressing, reinforce this, hold this, because this will continue to, the bowel will continue to come out, moisten the dressing, and this is an emergency.